Good afternoon, everyone. Thanks so much for joining us for Tourism Tuesday. Some of you are on every Tourism Tuesday that we hold, so you know the drill. Some of you, I think it might be your first time because we're going to be talking about something quite exciting. And I know that people have been begging us to do some work around this for the last couple of months. So we've done the work. Well, we're trying to do the work. And what we wanted to do today is to just present some of that to you. It's not the South Africa's Travel Ready Collective's work per se. It is an industry collaborative approach that does not belong to any one brand or any one individual. And I think that that's important because that means that all of you who are in the room right now own that. And I'm looking to all of you to help us crowdsource the information to make sure that we feed the beast, essentially. So how it came about is people in the tourism industry came through to us and said that they really felt very worried about the narrative that was going out internationally around 501YV2, let's call it by its name, and not the South African variant. I know that 501YV2 is a difficult word to remember, but I'm enumerate. So if I can remember 501YV2, so can you, essentially. And what we're wanting to do is to go out with this call to call it by its name and not call it the South African variant, because essentially what happens when you add to the narrative that is happening all over the world, you can't really complain about the fact that people are calling it the South African variant. And as a result, our destination's reputation is being damaged. So before I go through my presentation, here is a little plea from me to you to keep your eyes open when someone says the South African variant, please correct them. It's 501YV2, 501YV2. And what I'm going to do today is I'm going to take you through the Call It By Its Name campaign, which we are doing as an industry. And again, this is not owned by one brand. It's not owned by an association. It doesn't belong to anyone. And the toolkit that has been created does not belong to one brand or any organization. It is a collaboration amongst a lot of different individuals, a lot of different companies, and a lot of different organizations. And you in the room are part of that. What we have tried to do is to give you a toolkit that you can use to communicate with your international stakeholders about what really is happening on the ground. But at the same time, our expectation is that we get feedback from you. So that is why I say that it is a crowdsourced toolkit, which doesn't belong to anyone, but belongs to everyone, essentially. Okay. I would like to pay tribute to Judy Lane, who used to be the CMO of Wesgro and has been working with Wesgro over the last couple of months. She, in fact, is the individual who coined Call It By Its Name. And I believe that it is only fair and proper for us to recognize that contribution because it is a campaign that we are going to go out with, not just in South Africa, but we're actually going to try and persuade other DMOs in the world to follow our suit. Okay, so the campaign is Call It By Its Name. The problem is that variants are going to be here for posterity. As long as COVID exists, we will have variants. In fact, I think there are about 48 variants circulating in the world at the moment. Obviously, press and politicians need to keep a lens off their own problems, essentially. And what do? They look for scapegoats. We in South Africa found a variant and we did the good scientific thing and we told the world about it so that we could make sure that vaccines would be able to deal with that particular variant. Our medical prowess, our scientific prowess hasn't stood us in good stead, however, because we have become the whipping boys for everything to do with COVID, unfortunately, and that has a massive, massive impact on our tourism industry and on our destination. And I'm going to ask Jackie Reynolds in a little bit just to communicate with you, although I'm pretty sure you all have your own stories in that regard, with some of the feedback that she received during their showcase out of the Southern European market. So as we can expect these variants to continue to emerge, this current way of calling variants based on the destination it was first found in does cause immense reputation damage. Today it's South Africa, Kent. I don't know, the Brits managed to sidestep the UK variant and are calling it the Kent variant. I feel very sorry for the Kent Tourism Authority, with whom we are actually meeting on Friday, by the way, Monica Yule from Wesgro and I, to pitch the Call It By Its Name campaign. But tomorrow it could be somewhere else. It could be India, it could be Germany, because variants exist. And we want the entire destination marketing organization, institutions, global scientific community to stand together and dispel this way of calling variants, because it is destructive and it is not scientifically accurate. And we saw at Africa Travel Week last week, there was an investment summit, and we had the former Secretary General of the UNWTO and the World Tourism Travel Council president coming out very strongly against this way of calling variants, as well as calling for a standardized regulation across the continent so that we don't have Zimbabwe asking for 48-hour PCR tests and South Africa 72-hour PCR tests. I mean, it's just damn ridiculous, isn't it? How are we supposed to do tourism? Anyway, so what we in this community here, the people who are in this room, yes, maybe you don't have the WTTC contact. Maybe you don't know how to reach the UNWTO Secretary General. Maybe you're not a journalist and you can't publish an article about this, but maybe you are the person who's on social media and sees someone calling it the South African variant. I want you to call them out. I want you to tell them to call it by its name, and I want you to say it's 501YV2 if we are referring to the South African variant. So we can all start today as tourism stakeholders to not add to the narrative of South African variant and call it by its name, 501YV2. So some of the messaging that we've looked at, and I will unpack in a little bit of depth later on how we're going to be communicating this. And the reason why we're giving you this messaging is so that everybody can sing off the same hymn sheet. So if you are responding to an inquiry from an overseas customer, remember that these are the messages that we're wanting to come across with as one tourism tribe, if you will, out of Southern Africa. That travel is safe and normal, and that we have COVID protocols that have been adopted and are being consistently applied to keep guests and staff safe and healthy, but also to improve the user experience. That variants are normal and they should be called by their scientific name. Yes, even if that scientific name is a number, and I said, I'm enumerate, I can remember 501YV2, so can you. The tourism is everyone's business. So as much as we are all hurting on this call now, there are laundry providers that are hurting. There are car manufacturers that are hurting. Tourism's roots, supply chain roots are very, very, very deep, and they have a wide-reaching impact for the well-being of the entire economy. That travel is important for your well-being and health. There is this pent-up demand that we keep hearing about from your customers because they have been in the shadows of a lockdown for such a long time that they want to break free. They want to get out. So yes, travel allows you to be in an environment that is not your current environment. It gives you a level of escapism that other things don't give you. And this is my favorite. We are one tourism community. We can advocate for standardization. We can advocate to call it by its name. We need to stand together to dispel the damaging narratives. It doesn't help for you to see those damaging narratives and to come through to me, Natalia, and say, you need to do something about the damaging reporting that is happening internationally. I really am not that good, trust me. But if all of us worked together to dispel that narrative, it would be a hell of a lot more powerful. So what we've tried to do is to give you the messaging, we've tried to give you the tools, and now what we're saying to you is we've started the race, this relay race. What we want to do is give you the baton to take that information and distribute it to your customers, your extensive networks that I, Natalia, the South Africa's Travel Ready Collective, Westgrow, SATSA, TVCSA, FIDHASA, all of these associations don't have. The next leg of the race is up to you. So where do we do this? We do this through media, and we do have PR networks all over the world, but you have PR networks. If you have representation in overseas source markets, they have PR networks. So don't just think about your collective around you, your circle. Think about the circle that is beyond that inner circle and the circle beyond that. What networks can you leverage to get the information out? We will give you the information, but you need to take it the last leg of the race. Of course, we want to say as South Africa that you can't call it the South African variant, that you have to say it's a 501YV2. It's a little bit like marking your own homework when you say, look at us, we're not, everything's okay here, we're not too bad, you guys can come here safely, the South African variant isn't as scary as everyone is saying, blah, 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 blah. It doesn't work when South Africans, and there's people in the tourism industry who have a vested interest in tourism being open, say things like that. So we need people outside of our industry, people outside of South Africa, to say that South Africa is safe. So we have to identify who those thought leaders are, like the former UNWTO Secretary General, who applauded the way that South Africa had dealt with identifying the variant. Those scientists, like the Dr. Sanjay Guptas from CNN, who recorded something a few weeks ago about how well South Africa has managed things. Who are these individuals who can talk about what's happening in South Africa so that it's not us marking our own homework, that these people are thought leaders and are recognized and are very happy to put their stamp behind South Africa. We need to identify those institutions like the UNWTO, WTTC, World Health Organizations that call out against the way of calling variant. Sorry, I'm just going to mute someone because they're making a little bit of background noise. There we go. Sorry. And if I can just ask Danielle to please just keep an eye out and mute anyone who is unmuted. And the DMOs that are affected, yes, but also the DMOs that are not affected, because remember, today it's South Africa, Kent, and Brazil. Tomorrow it will be someone else. So can we get DMOs to stand shoulder to shoulder with us in South Africa to say, call it by its name? And then, of course, lastly, all of your own platforms, all of your immediate circles that you can get information out. So I think on that note, I'm going to ask Jackie Reynolds to put her on the spot. Jax, if I can ask you to unmute and just explain to us, based on the meeting that we had a meeting about a month ago with 35 people in the industry who had extensive networks or were strong marketers, and we put this appeal out to them. And Jackie, as you may know, is part of On-Show Solutions, and they have done a whole bunch of extensive roadshows over the last month or so. Jax, will you just unpack a little bit about what you went out with and what kind of feedback you got?
Sure, thanks, Nat. So don't phone Natalia unless you're prepared to jump on one of these little chats. So I phoned Natalia earlier today, was just really to update her on what we've been up to. So a few weeks ago, we had a great meeting actually with a few folk just to look at how we can market South Africa and just the bigger image that we're putting out there. What are we talking about? How are we being perceived? So we put out a number of the safe travel videos that Wesgro had done from Cape Town Airport. We shared those with all of the buyers who were on the Africa Showcase online last month at the end of March. And it was really just to do our bit to try and get the word out there. But the reason I'd phoned Natalia this morning was just to find out, are there any updates coming out of South African tourism specifically that I wasn't aware of? Because I think the big thing with all of our operators internationally is that they do look to South African tourism for guidance. And they do want to know what is South Africa putting out to their audiences so that it can help them in their markets. And I think our private sector initiatives are fantastic. But I do think that we need to also be working with South African tourism to try and put one joint message out. So the story really that I was sharing with Natalia was in our market presentation for Southern Europe. We had one of the Italian operators who actually raised a big concern. You know, the discussion came up about the variant and everybody talking about the South African variant. And at the end of it, I said, listen, actually, we need to be talking this correctly here. We need to be calling it by its name. Let's use 501YV2. We all know it's not catchy, but this is what we need to be doing. We need to be calling it by its name. And the one thing that Claudia had mentioned specifically, this operator, is that she really felt that South Africa would be able to lead the way in how we were going to be managing the virus coming out of Africa up until November last year. And then she said with this new South African variant coming out, it was a major worry, a major concern, because suddenly we're not getting it right. And what is the message that is now going out? And the big message is that we need a PR campaign into these markets. They don't know that the infection numbers are low. All they know is we have this really dangerous variant. So the plea was just to say what is being done, and is there an initiative that can help them in their markets? to try and get their business back on track. So that was really a red flag, and that's why I'd gotten hold of Natalia to say, what can we do? And what is the plan coming out of South African tourism, and how can we work together to try and get that message out even further?
Thanks, Jax. And I think that that's the message with this campaign that we put together, getting 35 people in the room, was that this isn't about one company or one organization. It is not fair for us to look to SA Tourism and expect SA Tourism to drive this on their own. We've really got to be working together as a private sector and bolstering what SA Tourism does, and vice versa. We need to be working, I hate to say we need to be, we should to be. It's a non-negotiable. There is nothing about, you have to park your brand at the door. This is not about you anymore, essentially. So we can, to a certain extent, give you tools to help you get the message out as the private sector. And I'm pretty sure that SA Tourism has some content as well to go out with it. But that's just the first leg of the race. The important leg of the race is distributing that information. And if a tree falls in a forest and nobody's around to hear it, did it really fall? So you really have to take that information and distribute it and do what you can in an aligned way. If we give you the messaging to communicate to your customer base internationally that we're not all terrified, hunkering underneath our beds, eating Kit Kats because this mutant virus has just swept across the plains of South Africa, which is, if you've read the news in the last 2 months, it's pretty much headlines that I see all over the place. So what we did was we created a website called, it's not a website, sorry, let me rewind. It's a toolkit. It doesn't belong to anyone. It doesn't have a brand. It's a toolkit that we have created, an online toolkit for you that's got a live COVID dashboard on it. Every day we curate content from news sites about what's happening in terms of vaccine rollout in South Africa, what's happening in terms of 501(y)(v)(2), anything that is related to healthcare or medical facilities being, not having any COVID patients in them, anything that portrays what's happening on the ground. Yes, sometimes that stuff is not nice because it talks about vaccine rollouts not being fast enough, for example, but we have to have the courage to be honest, because if we only paint a positive picture, people are not going to believe us. So warts and all, it's on this website and it gets curated daily, and I'll show you. We have FAQs, which we have created based on the questions that you have told us your customers are asking you. And those questions will evolve. You might get an Italian tour operator saying to you something different tomorrow, which needs to be responded to. We're happy to answer those questions, but we need to know what those questions are. So please send us any questions that you are getting from your customers so that we can add those to the FAQs and crowdsource the information and the solutions so that everybody benefits. And lastly, social media videos, which again are brand agnostic. They belong to South Africa. It's all about the destination, showing open spaces, beauty, and an escape. And again, nothing belongs to anyone, essentially. So if I can just show you this toolkit, it's not a pretty website. We didn't spend forever on it. It doesn't have a brand, but we've got our COVID-19 dashboard there, so you can go and have a look. This is pulled from the NICD. And if you tab there, you'll see South Africa in the news, and you can filter by a whole bunch of different tags: PCR testing, vaccine, 501(y)(v)(2), third wave. It is in order of date it was published. And if you just click on it, it will pop up eventually when my internet decides it's going to cooperate. Or not. Okay, we'll give it a skip, but go and try it. And the URL is visitsouthafrica.info. Visitsouthafrica.info. Okay, there's a trade toolkit, which again doesn't look pretty. It's not meant to look pretty. It's just meant to give you some information, some resources that you can go and get information from, like the Westgrow. They're amazing videos. If you haven't seen the videos that Westgrow did around, I think about a month ago, where they interviewed people who were leaving South Africa at Cape Town International about their experience. So there's first person perspective. So go and have a look at that. There are some graphs here, which I know Gillian Saunders is always a favorite of, and it looks at how we compare to other parts of the world, because if we're getting constantly compared about how bad things are, it's always nice to see how your source markets are faring as well. So that map is there. And then those Westgrove videos that I was referring to below there, they're on YouTube. You can literally copy the link and send the link out in a newsletter, on social media, however you wish to do it. The FAQs. Again, not pretty, but it's all the questions we've received from you and we've responded. Sorry, my internet's a bit slow. There we go. You can literally copy and paste this. We've also given you additional resources that you can go and look at if you want. How easy is it to get a PCR test in South Africa? All the places where you can go and look, etc., etc. So you can move that. And what we are asking to help us, because this is a beast that needs to be fed, is to help us crowdsource those news links. So we are looking every day for news about 501YV2, vaccine rollout, Destination South Africa positive news, healthcare, medical facilities. If you see a story, even if it's not a nice story, send us the link so that at least we know that it's there and we can decide whether to ship it up or not. It's much easier if you've got lots of people looking instead of just a few people looking. Send us the questions your clients are asking so we can keep that toolkit updated on an ongoing basis. Send us any video footage that you don't mind us using for those general social media videos. We will credit you, but it's not going to be a video on your property specifically. We're just using them as very short social media clips that anyone in the industry can use on their social media to reflect Destination South Africa and its beauty. Share the information with your networks. Remember, you're the second part of the relay. I don't have those contacts, so you need to do that job for us. And lastly, call it by its name, 501YV2. It's not hard. Yes, it's not sexy. I'm sorry we don't have a sexy name for it, but variants are not sexy and neither are viruses. So suck it up and call it 501YV2 because it is not the other name, which we will not mention from here on out. Okay. So please do call people out when they are talking about it because they just add to the narrative and it's an incorrect narrative. And we really want your teams to stop calling it as well, please. Let's call it by its name, 501YV2. All right. I've spoken a lot, so I'm going to stop speaking. Any questions? I see there's a lot of stuff in the chat. And actually, I want to thank a lot of people already are doing such amazing work by supporting and sending information out and sending us. I know, Chris, you've got your hand up. I know SA Tourism did and Rachel sent it to us, did a study the other day around this, and it wasn't such a big deal. That stuff is all really helpful. So please keep sending us stuff. Chris?
Can I just make 2 observations? Thank you for all of this. It's absolutely fantastic. It's always great to be here, see so many familiar faces. 2 things. One thing, so from a European perspective, travel is illegal at the moment. So that's one of our biggest things that we've got to get over. From a government perspective, it's one thing doing what we're doing here, but we have to engage as much as possible with government. And that's what us as ATTRA are trying to do, and trying to get Southern Africa, all of Southern Africa, off our red list. So the various things that they're looking at with the Global Travel Task Force is the state of the pandemic abroad, so numbers. So any numbers need to be shared. Progress of vaccination programs. So the progress of vaccination is key. So what Zim are doing, what Vic Falls have done, vaccinating that area, that sort of information is fantastic to get across. Variants and the efficacy of vaccines. So any information that we can gather that can be fed to government is useful. Status verification. So if there is a COVID vaccination certificate, if you've got any information, share that. We, as ATTRA, through our lobbying, have got channels into government. So if you can share any of that information with either Natalia or directly with me, I can feed it in, and they're all the little things that are going to get things moving forwards. We have to share information, we have to get it through to the right sources, but it's one, yes, the consumer confidence is an issue, but the biggest issue is the governmental issue and the fact that travel is not currently legal and there's so many barriers in the way, and it's government that can unlock that.
Chris, if I can ask you a question around getting those science-led narratives out. Is it, and I have a sense that South African scientists saying that it's not as bad as it's made out to be is again just marking our own homework. Is there not an argument that says we need to be looking at scientists elsewhere in the world who can speak to this with authority, so that it isn't just us here in Southern Africa who are saying, well, you know, really, we don't know what the fuss is. It's really not as bad as you're making it out to be. And if that is the case, who has the contacts to get that done?
Yeah, so it's got to be international scientists, and it's got to be international scientists looking at how the different variants of the variants of the virus impact different populations in different areas of the world. So they need to look at, yes, the 501v2 is impacting the South African population in this way, but it actually impacts the British population slightly differently because of different demographics, a variety of different factors. So that's the sort of data that we need to see if we can get hold of to share with the right people to make things hopefully move forwards.
And I know, Jackie, you were mentioning a little bit earlier that your Italian tour operator, for example, said that they have to take AstraZeneca. They don't have any other vaccine available to them. And that was another thing that was slightly off-putting. So speaking to the vaccination aspect of things, I suppose, would be just as critical. Okay, anybody else? Thank you for that, Chris. I really appreciate that. And thank you for your support. You have been a stalwart.
Always here.
Jax.
Natalia, just one more thing there. I think it was Chris who asked it here about the Corona Pass in Denmark. On our Nordics presentation that we did, that was also quite interesting to see that there doesn't seem to be any major resistance to having a vaccination in order to travel to Africa. There's general acceptance when you travel to Africa, you need to take malaria medication, you need a yellow fever certificate. I mean, when we started working on MKTE going up and down into Nairobi, I mean, it wasn't even a question. You couldn't go into Nairobi unless you had a yellow fever certificate. So I think that out of the Nordic market in particular, they really didn't have any issue about needing a vaccination in order to come to Africa.
Yeah. Thanks, Jax. Anybody else? We've got Wendy. Wendy, are you vaccinated?
I actually had my first one. They ran out of certificates, and we've got a scrappy little piece of paper. I'm trying to get to America next month, and they certainly won't accept that. Although getting into America at the moment, you actually don't need this the vaccine certificate. But I think eventually you will. I think we're still going to have to have these tests for even if you've got the certificate. To be honest, just two things, and both slightly off the point, but somewhere in the point. First of all, thanks very much to you and your team. It's always such a good discussion on a Tuesday, and it you know, with everybody else kicking in, there's always some good topics being discussed. And secondly, on behalf of all my colleagues in the Zimbabwe industry, I do apologize for our 48-hour test.
Yes, Wendy.
It would have been nice for the SADC presidents to get together and let's stand as one, but obviously that was beyond us all.
Well, that doesn't mean it's beyond us forever. So hopefully we can get them in a room, or as Taleb Rafai was saying last week, put them around a table and don't let them leave the room until they agree to one standardized protocol, which is a minimum standard across the board. So I still have hope that that can happen, essentially.
And thanks very much to Chris for putting in a good word for Vic Falls. Usually Zimbabwe is the underdog, but the vaccine rollout in Vic Falls is working amazingly well. the having the test, you know, that we can, Lancet will come to the hotel room. I think it's an extra $10. So it really is working very well. But that point Jackie brought up, we've always had a yellow fever certificate to get into East Africa. Nobody ever thought of it. You just had it, you had it done, you got in, and there was no excitement about it. So, you know, it certainly should be possible.
Thanks for that.
Thank
Anything
you.
else? Thanks, Wendy. Okay, so you're probably thinking, what next, essentially? This website is up and running. It's there. It's visitsouthafrica.info. If you put visitsouthafrica.info into your search browser, you would get it there. We're populating it on an ongoing basis. But as I said, what we need from you is help. We need you to send us that stuff. Because the more people who are looking for it, the easier it is for us to put on that website and for everyone to benefit from it. So we need you to look for those links. We need you to send us the questions that your customers are asking you. You know, as Jackie's just mentioned with her Italian tour operator, there are questions that our customers are asking, and they're difficult questions to answer. They're not questions we want to answer, but you know, we need to be willing to complicate the narrative. We need to be willing to be authentic and to say it how it is, because otherwise it won't be believable. There'll be no credibility in it. So what are those questions that people are asking? If you have video footage that you're sitting on, please send it to us. We have people who can edit the video footage into lovely social media clips that we can all use to market South Africa. And share this information with your networks. Get the message out. Run that second part of the relay. And lastly, call it by its name. 501 YV2. 501 YV2. It's not sexy, but it's not that hard. I promise. I can remember it. Okay, thanks guys. That was a short and sharp Tourism Tuesday, but I would love any feedback that you've got, any comments, if you feel that we're completely off track, if you have any suggestions to help us. As I said, this is not a South Africa is Travel Ready initiative, but it is supported by South Africa is Travel Ready. It doesn't belong to anyone, it belongs to all of us. So my expectation is all of you have to lean in and help to get this up and running. Okay. Thanks, guys. Yes, maybe we need to have a song with 501. Great idea, Lorraine. Awesome. Have a good evening. I hope it includes wine from Stellenbosch, Jean-Rett. Cheers.